Good morning everybody, and welcome to this new event brought to you by the Center for Market Education and Ideas, the Institute for Democracy and Economic Affairs. You know that our activity started at the end of last year, but this is our third seminar for 2020, and of course, as everybody may desire, may want, we will focus our discussion today on a topic which is related with COVID-19. And this seminar will be recorded, so it will be available on YouTube. If someone is interested to receive a copy of the link, can reach Center for Market Education via email. All the contacts are on our website, marketedu.org. Today, we have the honor of having a great international guest, Professor Roger Koppl, which is a professor of finance in the Whitman School of Management of Syracuse University in New York, and a faculty fellow in the university's Forensic and National Security Sciences Institute. Professor Koppl has served on the faculty of the Copenhagen Business School, Auburn University, Fairleigh Dickinson University, and Auburn University in Montgomery. He has also held visiting positions with New York University, George Mason University, and University of Vassar, and the Max Planck Institute of Economics. Moreover, Professor Koppl is a past president of the Society for the Development of Austrian Economics and a former editor of Advances in Austrian Economics. So we are very honored and glad that Professor Koppl accepted our invitation, and we look forward to hearing his talk today. I had the idea to invite Professor Koppl by reading this book, but it's not like showing a real cover because it's a Kindle. So I'm reading the Kindle version of his book published in 2018 with Cambridge University Press, Expert Failure. And reading the book, I found that the topic is very much relevant in the present moment in which we are dealing with the COVID-19 emergency. Because if you notice, in the end, even here in Malaysia, we rely on decisions that are taken for our lives by so-called experts, medical doctors specifically in this case. They are telling how dangerous and how not dangerous is eventually this virus, what we can do, what we should avoid to do in order to minimize the damage. And it's quite striking because everywhere in the world, policies to try to contain the spread of the virus have been based on a single study, which is the infamous Imperial College study, who was predicting massive deaths if we would have not locked down our societies. These predictions didn't happen, both in countries that applied the lockdown and both in countries that didn't apply the lockdown. And what is actually striking to me is the religious zealous on which that was followed in applying the recommendation from the Imperial College studies. But one of the basic rules of the scientific method should be that we progress in our knowledge through doubt, through verification, falsification, and starting with the assumptions that our knowledge is always limited. So we should always be humble in giving recommendations and in addressing policies issues, also from the perspective of the experts. It goes without saying, and sometimes I'm also called from the media because I'm a so-called expert, that there is an aesthetic fascination in being considered an expert. So this necessity of humbleness is conflicting with our own pleasure in being under the spotlight, and this can deviate probably also us as experts from the right path that we should follow. And indeed, if we look at the history of expert predictions, we look at the history of a lot of failures. By digging into the COVID-19 phenomenon, I read some of the scientific studies that were published when HIV appeared in our lives, and we found peer-reviewed academic studies published in top journals that were saying that kids can get the HIV from the parents just by living in the same house. Now, if we say the same things, everybody would laugh at us. So the problem is not, I think, that experts indeed fail. The problem is that we should treat experts for what they are. They give predictions, they give opinions that are not revealed truth. So experts are experts, not oracles, not gods. So probably if there is a failure from the expert side, there is also a failure from the public side and from the policy side in considering experts for what they are not, and they are not supposed to be. And trusting too much the experts and basing policies on only one-sided expert advice can lead indeed to bad outcomes, even in terms of tyrannies. And we have seen how during this COVID-19 emergency, many among us were at disposal to give up their most important individual freedoms in order to comply with the suggestions of the experts. But I will not steal any more time from Professor Koppl. The floor is yours, Roger, and we will come back later on for questions with our public.
Okay, well, thank you for that very generous-minded, that kind introduction, and that fabulous commentary on experts and the sort of romance and fascination of being an expert. I mean, those were really, I thought, very appropriate and very nice remarks. Well, so it's great to be here. Thanks again for having me. All right, let me get my slides up and running. I think we can see that. So that's the book. There's an image of the cover of the book. I think I first just want to sort of say a few words to suggest that there is a problem of experts, and it matters. That's a less difficult task to do now than it was before the virus, but still. And then go on to do some of the sort of the analytics, and then a little application to current events. And unfortunately, there are plenty of examples of expert failure. It can be a technical problem. Expert failure can be a business problem. I don't know how many of our webinar participants will remember these Samsung phones that were sort of blowing up and maybe burning you when you had them in your pocket. It can be an economic problem. This is Alan Greenspan, celebrated as the greatest central banker of all time, but the greatest central banker of all time was not able to prevent the Great Recession, and he later, in fact, confessed to, of course, foresee the Great Recession, and he later confessed to a flaw in his model of capitalism, his famous mea culpa commentary. I think here in the US, we've had some increased skepticism of experts, and I think there's many contributing causes. Two big contributing causes, I think, was in fact a great recession of 2007 to 2009. You know, Americans could see who got bailed out and who didn't. And they could see that the experts had few really, had little prevision of the event and not that much in the way of remedies for it when it struck. The other event, I think, among many, but maybe the other most salient event that sort of contributed to skepticism of experts in America was the weapons of mass destruction fiasco, whereby all this sort of intelligence services and the experts assured us that there were weapons of mass destruction in Iraq, and the U.S. then entered into a war with Iraq because of them, and yet, of course, they were utterly absent. Getting back to sort of my list of things, expert failure can also be a social problem. Let me spend a few words on this. This is the Flint water crisis. So what happened in Flint, Michigan, this picture is from 16 October 2016. That's a hospital sink in Flint, Michigan. Flint is almost a sister city, is sort of a fraction of Detroit, Michigan. So there's car making facilities there. It used to be quite the center for industrial activity in America. They had some fiscal difficulties as a so-called Rust Belt city. They made a change in their water supply, and it came out of the pipes brown. And it turned out it was absolutely dangerous, lead-filled poison, very harmful, toxic to the people of Flint, Michigan, particularly and especially to her children, who have, in fact, it now appears, suffered in quite high and disproportionate numbers intellectual defects because of the lead they were drinking. And the experts, the health and environmental experts at the federal level in the United States and in the state of Michigan in America, were assuring the people that the water instead was just fine, don't worry, you can drink it. I think maybe I'll have just one more example of expert failure. I would like to say just a few words about the related topics of eugenics and population policy. So eugenics is, the idea that somehow the disfavored characterological traits are heritable. So it is the job of government to control the population, to control who may reproduce and who may not reproduce, perhaps with forced sterilizations or perhaps by other means. That's eugenics. Eugenics was a very, it was scientific orthodoxy for decades prior to the tragedy of the Nazi-induced Holocaust in Europe, after which eugenics fell out of favor. And yet, as recently as 2010 in California, there were eugenic practices going on in California prisons. Women who were giving birth in the prison system, so women who were prisoners in the prison system giving birth, were pressured into, or perhaps even coerced into, tubal ligation, which is a form of sterilization, according as prison authorities considered them to be a high or low risk of recidivism. So if they thought, that this woman's going to come back to end up back in prison again, they would pressure her and increase pressure upon her to undergo tubal ligation immediately after birthing her child in the system. Well, that's a straight up eugenic practice. And as recently as, and that was 2010, we may reasonably fear that such practices are going on still in, perhaps in the California prison system and perhaps in the prison systems of other states of the Union. As recently as 2017 in Canada, same thing was going on, but based rather on the status, a woman's status as indigenous. So nothing about the prison system, it's just in certain hospitals, indigenous women were being, if not coerced, certainly pressured into undergoing this procedure of tubal ligation based on the fact that they were so-called Indians, indigenous women. So this is utterly racist and eugenic policy. That is quite alarming to me, just how recently. I used to think as a child growing up, oh, there was, eugenics was this thing from the past. So glad it's gone. And tragically, we see that actually it's not gone at all. Now, as I indicated, eugenics, properly speaking, means that disfavored characterological traits are heritable. That's not true for something called population policy. But with so-called population policy, the size of and the composition of the policy of the population, is a policy objective. And I'll give you an example. Several policy issues have been linked to population size, including so-called global warming. Fewer people, especially fewer rich people, we are told, would imply fewer carbon emissions, and that's like good for the environment. And in fact, an important article on this was published in a journal, Social Theory and Practice, in which we find that it argued that policies that do not, and now I quote, consider population as a variable to be manipulated might turn out to be too little, too late. So the more urgent the climate change policy is, the more vehement is the pressure to have a population policy, which we're going to try in some way or another to restrict or control reproduction of humans, people having children. Now, this is not just sort of some, funny academic idea that's going on in some corner of academia. It's hit the popular media here in the US. We have a popular television show called Bill Nye Saves the World. And these ideas were vetted somewhat favorably on that show. So, this is like real stuff. It's not just, academics are supposed to think of wild things and then the ideas are vetted. No. This is a serious idea, very much on the public, on the public's radar screen, in the policymakers' radar screen. So I think from these various examples, I think it's fair to say that there is a problem of experts, and it matters. So it seems to me that we need to establish that in order to show that it is indeed worth knowing under what conditions expert failure is more likely and under what conditions expert failure is less likely. If we can influence those conditions, and that's already a question, what conditions can we influence in this regard? Anyway, if we can influence those conditions, we may be able to reduce the incidence of expert failure or, the evil consequences thereof. The bad consequences, undesired consequences thereof. And if we know when expert failure is more likely, we may be able to protect ourselves against it in one way or another. It seems then that we need a theory of experts. So far in the world, there's really been, however, no coherent literature on experts. There is a sub-literature. There's literature on experts in economics. There's a literature on experts in a field that I study, forensic science. There's a literature on experts in science and technology studies. There's a literature on expert witnesses at law. These are separate literatures. There's no one literature on experts. No, in this sense, there's no coherent literature on experts. Rather, there's these disparate, many different literatures covering different fields, with important thinkers making no reference to one another, even when they're in some way traveling along similar lines of thought. So in writing my book, Expert Failure, I felt the need to do a history of thought on the problem. That's a little too much. That would be hardly different from a history of written thought. But there's a simple framework that lets us kind of organize arguments on experts and experts and non-experts. It kind of lets us organize past thinkers on the problem of experts. So here's the simple logic. If you're going to have a theory of experts, you have to have at least two categories of actors in your theory: experts, non-experts. You have at least these two groups of people: experts and non-experts. And you can have basically one of two attitudes toward experts and non-experts. For the experts, you can view them in some, vague sense as favorable, or in some way with some skepticism. I'm on purpose being vague because, of course, how you feel in those particulars is going to vary from thinker to thinker. So I made up a word, reliable. I don't mean that in some sense of statistical decision theory. I just mean reliable in the ordinary sense. Can you rely on these guys? So you may view experts either as reliable or as, sometimes at least, unreliable. What about non-experts? Well, same thing. You can view them in some sense as in some sort of a favorable or empowered kind of perspective, or as not being empowered. So what does that mean? Well, if experts are powerless, that means non-experts, pardon me, are powerless. That means in some sense, if you're not an expert, well, you're dependent on the experts. There's not much you can do. If the experts go wrong, it's terrible. If instead you view experts as non-experts, pardon me, as at least potentially empowered, then you're saying, well, at least potentially, perhaps under the right circumstances, the non-experts may be able to compensate for expert failure, or know when experts are giving reliable or unreliable advice, or figure out some strategy to get reliable in some way. They're not just, dependent upon the experts and just, unable to act and have, in sociology language, have no agency. So these are the two possible views of non-experts. One sort of, powerless versus empowered, experts reliable versus unreliable. So that gives you four different two kind of agents, two kind of actors in your model, two kind of attitudes toward the actors. Gives you four different possible kind of theories of experts. Those who view experts as reliable and non-experts as powerless tend to favor the rule of experts. They tend to favor giving matters over to the hands of the experts. I think there's a lot of people we can put in that box. I was surprised in researching the book to discover that I think Socrates belongs in that box. Less surprisingly and less controversially, Plato and Aristotle, and I think the whole sort of Platonic and Aristotelian tradition of philosophy, at least in its earliest decades and earliest centuries, was very much in that, experts are reliable, non-experts are powerless box. More recently, Francis Galton, one of the great fathers of eugenics, is in that box. J.M. Keynes, the economist, also interestingly a eugenicist, is in that box. If we go down and look at, the experts are powerless, non-experts are powerless, experts are unreliable. There are people actually in that box. Michel Foucault, the famous French philosopher, Michel Foucault, pardon me, the famous French philosopher, I think, is in that box. The German sociologist of knowledge, Karl Mannheim, is in that box. Mannheim comes from Marx. I on purpose didn't write the name Marx there because he's so controversial. What did he really mean? But there's at least a case to be made that he might belong in that box. People that I like, Robert Burton, Alfred Schutz, Alvin Goldman, view experts as reliable, and happily, in my view, non-experts as at least potentially empowered. And finally, the box that I like, folks who tend to oppose giving experts too much power, are those who view non-experts as at least potentially empowered and experts as at least potentially unreliable. And there's some names of people I feel fall into that category. Okay, so I'm running ahead of myself. A theory of expert failure, the top row, a theory of expert failure would seem to put us in the bottom row. If experts are reliable, there's not much to be said about expert failure besides, sometimes humans make mistakes. If a theory of experts and of expert failure is going to be useful, we almost have to be in the right-hand column. Because if I have a theory of expert failure in which, however, non-experts are powerless, that's not helping me to avoid the risk of expert failure. So if to have a useful theory of expert failure, we almost have to be in that lower right-hand quadrant, viewing experts as at least potentially unreliable, but non-experts as at least potentially empowered. Okay. So that's kind of the basic framework. Now, you know, when we think about this problem of experts, it was characterized very well by a couple of guys named Peter Berger and Thomas Luckman in their famous book, The Social Construction of Reality. I'm quoting them now. I require not only the advice of experts, but the prior advice of experts on experts. The social distribution of knowledge thus begins with the simple fact that I do not know everything known to my fellow men and vice versa, and culminates in exceedingly complex and complex and esoteric systems of expertise. So these guys really got the point. We have experts because different people know different things. And no one of us can know all the different things that actually we need to know to make our choices in life, even some of our most mundane daily choices. So we're sort of like the fellow in this picture. We're shrugging our shoulders. We don't know what to do. Gosh, I need to know, you know, so much to make a choice. I have to rely on the experts. I don't know what else to do. So we want our experts to be like this. Right? These great angels guiding us, you know, upon whom we may rely. Okay? But of course, sometimes experts are more like this. Certainly, we fear they may be more like you know, demons who will send us awry, or maybe more like this. This image meant to represent a sort of silly and foolish person subject to avoidable errors. But of course, the really, you know, central key fact, sounds almost silly to say it, but it absolutely is not, is that experts are people. They're human beings. Yeah. That sounds almost trivial. Who in this webinar today, whoever would suggest, oh well, experts are not they're not just humans. They're somehow above humans, or they're not just humans. They're subhuman, you know, demons or something like that. They're angels. They're demons. No, they're persons. They're persons like just like non-experts. They're not divine creatures. Some are evil. Some are good. Some are wise. Some are foolish. They are humans and thus fallible. They are humans and thus, and this is very important, motivated by the same things and to the same degree as other humans. This humble truth, experts are people, has surprising implications. If we're willing to chase them down consistently and logically, that's the trouble, you know, to draw out those implications. But if we're willing to do that, we can get some surprising implications out of this humble insight that experts are people. If expert failure, and therefore, if experts are people, if they're fallible, then in some strange sense, expert failure is actually normal. And if expert failure is normal, then we ought to think about what makes it more likely, what makes it less likely. We should try to figure out what conditions tend to discourage expert failure, and or mitigate the consequences of expert failure, which conditions have the opposite bad result of either encouraging expert failure or somehow aggravating or not mitigating the consequences thereof. So that's why there's room for a theory of experts. Okay, excuse me. Thank you. Thank you. So that's why we need to have a theory of experts, which I call, just a piece of lingo, the theory of information choice theory. Anybody who might be watching on YouTube or listening in our webinar today may recognize information choice theory. That label is kind of an allusion to public choice theorists who pointed out that people are people, whether they're interacting on commercial markets or in political markets. One last thing here before we get to the qualities of an expert, very importantly, I haven't yet even defined what an expert is. So let me actually return to this image and talk about that for a second. The standard the standard normal way how you define an expert, it's really, in my experience, in my reading, it's universal with the partial exception of the theory of expert witnesses at law, because expert witnesses occupy a special function in the law. But with that sort of partial non-exception, everybody defines an expert by their expertise. The expert is the one who has the expertise. This is a terrible error. It's a terrible error for a couple of reasons. We've seen that different people know different things. There is a social division of knowledge. There's a social division of labor. Different people do different things. There is therefore a social division of knowledge. Different people know different things. Each of us occupies a unique place in the division of labor. Therefore, each of us occupies a unique place in the division of knowledge. Therefore, each of us is an expert. Each of us is an expert in their own area, whatever it may be. Well, hold on a second. If everybody's an expert, then nobody's an expert. So defining the expert by their expertise, I think, it just doesn't help us to understand what might be the problem of experts, or what might be the conditions encouraging or discouraging expert failure. There's also this other problem. If I define the expert by their expertise, I get trapped into an impossible, problem of trying to somehow identify who the real experts are and who the fake experts are. Which expert knowledge is like true and correct and therefore deserves the label expert knowledge, and which expert knowledge is spurious or even perhaps fraudulent. So all of a sudden I'm trapped into second guessing the knowledge of the expert. Well, wait a minute, we just saw that there's a division of knowledge. I don't have the knowledge of these many different experts. So it's just not letting us get off the ground to define experts by their expertise. I define an expert instead by what they do, by their contractual role. And forgive me for saying so, I think this was a progress just to identify the correct and appropriate definition for expert. An expert is anyone paid for their opinion. Now, so just a quick example, in American baseball, you have the umpire who makes many decisions. The umpire decides when the ball is on one side of the line and therefore fair and in play, or is on the other side of the line and therefore foul and not in play, for example. Okay. That's an expert because the umpire is being paid for their opinion, or the soccer referee and arbiter in football or European soccer. They're being paid for their opinions, even though they may not have a knowledge or expertise of the sport superior to the fans or the owners or the players or the coaches. But they're the ones being paid to render those decisions. That makes them the experts. Right now, as human beings, what are our assumptions about how these human beings, experts, behave? Well, there's three central assumptions in the theory of experts. They do not always seek the truth. We tend, when we just, when we implicitly model experts, and we're not thinking about the problem of experts, I think we often tend to assume the expert just is a truth speaker. And you can also see that made as an explicit assumption, surprisingly often. But it's not true, unfortunately. Often they do not always seek the truth. Some, yes. Most in some degree at least, but not all experts seeking only truth. That's simply not true because they're human beings. Experts are not smarter than others. So the so-called epistemic superiority of experts is a recurrent theme in other writers on experts. No, if experts are humans like other humans, they're not systematically of somehow inferior abilities or whatever, but they're not also automatically superior. They are not smarter than others. Economists will recognize I'm making a bounded rationality assumption. There's a lot of reasons I don't like that term, bounded rationality. I think there's a kind of a criticism of that, but it's a kind of bounded rationality assumption. Experts have no special pipeline to the truth or anything like that. Finally, there's this third assumption that's quite odd, but I was driven to it by my work in forensic science. I could really see it, in forensic scientists with whom I was interacting. Incentives skew the distribution of expert errors, even honest errors. Yeah. So, if a scientist in their laboratory does an experiment and they get a surprising result, maybe a result that in some sense they didn't want, what are they going to do? Well, if they get the result they wanted and they expected, they'll be like, great, we'll write this down, we'll send it to a journal, we'll publish our results, we have this new knowledge. We did this, laboratory experiment, we got this new knowledge, everything's great. What if instead you do an experiment and you get a surprising result, not the result you thought you were going to get, and maybe a result that somehow you don't want because it says that some effect that you thought was going to be there was absent or whatever it is. Well, you start to think, maybe was all my lab equipment cleaned properly? Were the reagents that I mixed together, were some of them maybe out of date? You start to look around for flaws in the experimental protocol. You look around for ways things could have gone wrong. Okay? Now, you might wish to and think yourself and strive to be perfectly neutral. But if there's that asymmetry in your response to a surprising or disappointing experimental result, then your work is biased. Because you're more likely to end up going to print with the result that conforms to your biases, your preferences, than the result that does not. You might be mortified to think that there would be that asymmetry in your response. But if it is there, then your work is biased in spite of your deepest desire to be anything but biased, to be only a complete and truth seeker. So that example, I think, illustrates more generally that experts, they are influenced by incentives. Incentives skew the distribution of expert errors, even honest errors, even when the expert is trying to be ever so neutral or unbiased or objective. So we recognize this. Information choice theory recognizes that experts are subject to biases and respond to incentives. Information choice theory recognizes that we tend to see what we expect to see, what other people see, what we want to see. Consider the figure on the next slide. Look at that middle figure, okay? What is that? Well, clearly it's the number 13. Or in this figure, what is the middle figure? Well, clearly it is the letter B. But of course, it's the same figure. Okay? What we see depends on context. Okay? And that fact helps to make bias possible, even when we're trying to be neutral. All right, so that's kind of a very quick overview on the theory of experts. And it lets us already put, the theory of experts to work. You see here a little map. If you're not colorblind, I'm colorblind, but even this distinction I can see between the green and the red. The green states there, as a matter of state law, state crime labs are paid in part at least, per conviction. In other words, if your forensic science analysis helps to convict the police suspect, your lab gets a bigger budget. That's true as a matter of state law in about 24 states of the Union right now in the US. So you can start to see why experts on forensic science, students of forensic science, want to see crime labs no longer organized under the police. They want so-called blinding, or we now speak of sequential unmasking, so-called blinding procedures that prevent the forensic scientist from knowing in some sense what the right answer is. I've called for redundancy. Sometimes we should get results from 3 forensic science labs and make sure they all line up. It's a trick to get, and very important to get those 3 analyses to be independent, but that's not for this talk tonight, or this morning, I should say. So that just gives you a quick idea. If you're just thinking about the incentives on forensic scientists when they're getting paid by commission, Okay. You start to see, oh yeah, okay, so that would be an example of that. We're encouraging expert failure. We should have a bit of a different system, maybe blind them to what the police theory is, make them not to be working for the police, and so on. You may have some redundancy in there. Maybe you'll be less likely to have false convictions based on forensic science error. And that sets me up for my theory of expert failure. Okay. I have 2 chapters in the book on expert failure. I like to think I covered a lot of sort of issues influencing the likelihood of expert failure. But the most important, I think, the key are sort of architectural issues, I think, are really just along 2 different dimensions. First, who decides? Does the expert decide for the non-expert? Or does the non-expert merely get advice from the expert and the decisions made by the non-expert? Secondly, monopoly or competition. Now, the poor innocent word competition can mean so many different things. So I sort of apologize for using a word that's subject to multiple interpretations. But we should ask, does the expert have a monopoly? Or are experts in some good sense competing one with another? So that you have free entry, so that the experts may have a diversity of opinions, okay? So that there's a real rivalry among the experts. If you have monopoly experts who are deciding for the non-expert, okay, you have what I call the rule of experts. So those state-administered eugenics programs we're speaking of earlier, that's an example of the rule of experts, or something like central bank monetary policy. You can't choose your monetary policy. There can be only one monetary policy. So there you have monopoly experts choosing for everybody else. So that's your highest chance of expert failure. If you think of something like, a state-enforced religion, okay, something like the Catholic Church was in Italy for so long. Well, okay, the non-expert decides whether they're going to adhere to the stipulations of the priests or not, but the priests are the only ones who get to promulgate their religion. So that's what I call expert dependent choice. I don't think that's great, but I think that's not as high a chance of expert failure as the rule of experts. Similarly, you could have competing experts deciding for the non-experts. In American suburbs, you have an example like this. If you're sufficiently affluent, you can work in the city and live in any of the suburbs around the large city. If you have the means to, that you can just sort of move from one city to the other whenever you like, then you're going to get the experts within the city who are deciding what's going to be in the school curriculum, where the stoplights are going to be, how much parking there'll be in the local downtown of the suburban town, where the crosswalks will be, and so on. All these kind of decisions are being made for you. But if you don't like the decisions, you go to a different town and get different experts to make, maybe a different set of trade-offs that's more suitable to you. So that's what I call the quasi-rule of experts. It's not great, but it's not so bad. But the best thing for my lights would be when competitive experts are merely advisory and cannot choose for you. So that's self-rule or autonomy in my lingo. We in America have a website. It used to be a magazine. I guess it may still be printed as a magazine. I don't know. Called Consumer Reports. So you get a subscription, and they'll tell you sort of which, what's the safest automobile, what's the best toaster, which dishwashers have what quality, and they make recommendations. And their track record is fabulous, because they're just giving you advice. You don't have to buy the toaster that they think is the best toaster, or the washing machine that they think is the best washing machine. So they're just giving advice, and they're not the only ones giving such advice. There are other websites and services and sources of information that are competing experts, okay, to whom you may turn if you ever decide that you don't like what the experts at Consumer Reports have to say to you. So that's the lowest chance of expert failure. We can see here that there's 2 basic institutional factors: Who's choosing, the expert or the non-expert? And then is the expert in some sense enjoying a monopoly or monopoly power? Or rather, in some sense, there's competition among experts. Those are the two sort of key drivers of influencing the chances of expert failure. So from the book, before we turn to COVID, the current unfortunate pandemic, the key points I want to emphasize now are expert failure is an important problem. It's a real thing. Expert failure is more likely when experts have monopoly power and when experts choose for non-experts. So we should, in my view, and now I'm going to quote the last words of my book, value expertise, but fear expert power. You can't sort of not value expertise. For the reasons we've given earlier, we have a division of labor, therefore we have a division of knowledge. We require the input of expertise. We need expertise, and we need, therefore, experts. But we should, because they are humans who respond to incentives, fear expert power. All right, so what does this suggest regarding the current COVID epidemic? Well, one of the problems we have today is that we of course must turn to the experts and seek out their wisdom, their expertise on the virus. In particular, and especially, we need the help of epidemiologists. But like economists, like every area of expertise is in a so-called silo. Each expert knows their area of expertise, and frequently little or nothing of what lies beyond that. Even an unusually broad expert will have limited expertise beyond their special area. So how in the world are you going to, you the policymaker or you a member of the Democratic electorate or anybody, how are you going to somehow weigh the different areas of expertise, figure out the right trade-off between, the consequences of shutting down the economy and what the economists might say about that, the consequences of not having lockdown, what the epidemiologists say about that. There can be no meta-expert who's somehow rising above all the separate silos of expertise. After all, if you could have such meta-experts, we wouldn't need experts at all. We just need the meta-experts who somehow have all knowledge. Well, okay, that's not the case. That's not reasonable. That's a sort of a utopian desire or something like that. It's not what we have. So so we're stuck with this fact that think of dentists and barbers. The dentist knows about teeth, but not hair clippers. The barber knows about hair clippers, but not teeth. So the barber is going to ignore going to recommend a haircut and ignore your toothache. The dentist is going to suggest you get caps or your teeth straightened or something and not worry about your shaggy beard. So those of us who are neither metaphorically barbers nor dentists, how do we adjudicate among these different areas of expertise? So we've somehow made ourselves in the modern world today, in our political systems, so dependent on experts that we end up asking the politicians to do a kind of balancing act or a trade-off among these expert areas of silos of expertise that's impossible for them to make. I think we also compound the problem by supporting professions. In the modern world, experts are organized in professional associations. I see I'm going on a little longer than I should have, so let me try to be quick. And so anyway, in America, for example, we have the American Medical Association that, if I may simplify a bit, caricature a bit, the doctors decide who else can become a doctor. The doctors decide what's a good and a bad medical school. Actually, it's a kind of body of doctors in medical schools deciding what are the good medical schools. So this is, and then you need to be approved in order to have graduated from an AMA-approved medical school in order to sit for a medical exam. So this illustrates the more general phenomenon of professional associations, okay, being state-supported. And the function of a professional association is to ensure unanimity of opinion. Okay? So within each area, there are sort of enforcement mechanisms to ensure that experts within the silo are all saying the same thing, have a uniform body of opinion. But it is exactly in the moment of crisis that we need sort of freewheeling inquiry, differences of opinion, viewpoint diversity in order to make our way through the new and alien situation. So we've built a kind of rigidity into our knowledge base by supporting these professions. What we've done is we've given experts powers. State-supported professional associations gives experts power, creates a kind of expertist template that is premised on the view that knowledge is somehow hierarchical. It starts at the top with science and cascades down to ever lower levels of the knowledge hierarchy. Mere practitioners must not question, the knowledge elite. And in fact, in some of the literature, this exact kind of language is used, the knowledge elite. But questioning is precisely what we need in a crisis. The famous physicist Richard Feynman remarked in his essay, "What is Science?" He said, "Science is the belief in the ignorance of experts." So we need that kind of challenging of the experts' expertise if we're to make our way successfully through new and challenging circumstances such as an unexpected pandemic. When we give experts power, including power to decide who the experts are, we choke off science. The premise of a rigid hierarchy of knowers is mistaken. The knowledge we need in normal times and crisis times alike is distributed across many different individuals, each of whom has a unique and individual perspective. It's out there in thee and me and all our habits and practices and experience. It's not a set of instructions and doctrines coming somehow from on high. It arises of its own from our many decentralized interactions. How much better would it be if we could tap into that diversity of knowledge and opinion? I better be quick here, so I'm going to just quickly flag the fact that experts have an incentive to alarmism. And I ask you to think what you would do if the Prime Minister called you and asked you, well, how many deaths will there be if we don't have a lockdown? If we don't insist that require that people stay in their homes? And you're an epidemiologist, but you don't know what's going on yet in the pandemic. The pandemic's just getting going. So whatever number you might tell the Prime Minister is a guess. So should you guess high or should you guess low? Well, if you guess high, then and you get a good result, great. Yeah. If you get high and you get a bad result, many people die. Well, think how much worse it would have been if we hadn't been, taking all these precautions. So that's going to work out for you. It'll be all right. If you guess low, and yet there are many deaths, and you turn out to have underestimated number of deaths, then great opprobrium will be upon you. And you're a decent person, you'll experience guilt. So the incentives all in favor of alarmism. Okay? This is very acute and evident in the current crisis, and I think it's a more general phenomenon that experts have a certain incentive again and again and again to say, follow my advice or doom will follow. So what does that mean going forward? I'm going to be quick because I've talked too long. But I would say there's two main things we need to do. There's many things. I don't know what we need to do, but I'm gonna identify at least two important things that we can do to, in the future, be less exposed to the kind of infirmities in the system that we've observed in the current pandemic, and therefore to leave ourselves less exposed to the risk of expert failure. First, and perhaps most important thing, is to eliminate state support for these professional organizations, okay? Which means that we must also relax, indeed, ultimately eliminate licensing restrictions. You can't do that just instantly. We got to figure out how to unwind the system. I don't think we know how to do that, but I don't think it's that challenging a problem. I think we can figure it out if only we have the political will to do it. First thing then, eliminate state-supported professional associations and the corresponding licensing restrictions. What's the other thing? Oh yes, is to reduce high levels of, it's almost a corollary thing. We should also, very importantly, reduce the high levels of regulation that are driving the state's demand for experts. And we should instead let decision-making be, more decentralized in general. Then, in moments of crisis, we'll be less dependent on one or a few experts to whom we turn for answers. We will instead get a greater diversity of answers, some tried here, others there. The system will be more heterogeneous, resilient, and adaptive. It'll be more like an ecology and less like a hierarchy. So in a word, my sort of post-COVID proposal is for greater political liberalism. Thank you very much.
Okay, can you? Okay, here we are. Thank you very much. Thanks for a very insightful presentation. I'm sure that the public, our guests, enjoyed the presentation. And we have still some time. If you, I know that it's late for you, but if you allow us, we can make some questions. Let me start. I would like to start with a very direct question. For the floor, instead, you can type your question into the Q&A section, and then we can read here and answer your questions if you have any. But let me start with a very direct one related with COVID, because I'm sure that this is the question that probably everybody has. So anyhow, the decisions of lockdown yes, lockdown no, in our institutional framework should have been taken by the policymakers, so by politicians, and everybody was expecting them to decide. What's in your mind in this specific case, an alternative system for decision? So how should have been, how we should have reacted in this situation, how the decision process should have worked in order to have a decision that was less dependent on both politicians and experts?
Well, but it's necessarily a political decision, as your question, I think, was saying. And I don't think it would be appropriate or wise for me to somehow, pretend to have an opinion on how much lockdown, how severe, or what the rules ought to have been, and stuff like that. I'm not an I'm an economist, but I'm not an epidemiologist. So I'm alarmed by how severe the lockdown was, how long lasting it has been, how improvised it all was. It seems to have gone completely not considered the great harms that disrupting the economy can bring. I mean, economics is a matter of life and death, not only epidemiology. So I do indeed feel all those feelings. But it has to be a political decision. I think if we had more decentralized decision-making there, state by state in my country, the United States of America, or maybe city by city or county by county, okay, rather than, at the federal level, that would be better. Now, let's not exaggerate. We do, it's the governors who are calling for, and not the president calling for lockdown and so on, but the president was a great leader in deciding, whether there should be lockdowns or not. And the decision was generally made, so it was deeply influenced by the federal government, which is a sort of has a disproportionate role in American politics. And at the state level, it was principally, almost wholly, the governor's decision, and not the mayor, the city council, or at the county level. So I think to the extent, it would have been wiser to let that decision making be more local. Okay. Then some localities would have got it right, some localities would have got it wrong, but there would have been a greater adjustment of the local rules to the local conditions.
Yeah, thank you very much for it. Indeed, we have seen these in cases like Italy, is also a relatively big country in which most of the cases were concentrated in a certain specific area, up to 60%, and we had the whole country locked down. When probably even thinking sort of national solidarity, those regions that were not under lockdown eventually could have helped the regions more in trouble to overcome the crisis. Instead, a generalized lockdown paralyzed also the possibility to support the ones that were more in need. And even we have seen this on a worldwide scale, where most of the countries, the great majority of the countries, have taken the same decision. And this is very much true if we look at the situation of Southeast Asia, where we had 700 million people under lockdown for something that is even ridiculous to call a pandemic, because we had something like 2,000 deaths out of 700 million people. And we are creating, we have also weaker social safety nets, so we are destroying much more lives by lock down the economy than by trying to flatten the curve. The curve was never growing indeed. 2,000 deaths over 5 months. Now we have 3 interesting questions from Mr. Yo Chuan Lin. Number 1, what are the red flags to identify fake experts? Number 2, how do you see the media's role in drumming up the reliability of experts? This is a very important question, I think, because, again, to put it in the context of Malaysia, where we had in the past few days the Ministry of Health pressing on how coronavirus is dangerous for kids, and all the media reporting this, and none of the media questioning if this was true or not. If we look at the data on kids, basically there is no evidences that this virus is more dangerous for kids. It's quite the contrary. In Italy, the median age of deaths of corona cases was 81. So we're not talking about something that... So the media not only work as an amplifier for the experts, but probably they gave up on their role to question the experts and to do their own investigations. 3, what are your thoughts on the best way to dispense advice to others?
Okay. What are the red flags to identify fake experts? Here, actually, we come to the importance of my definition of expert as anyone who's paid for their opinion. Okay, so I'm sort of not in the business of saying who's, well, I mean, the very question, how do you know who's a fake expert, means that an expert has true knowledge. No, not necessarily. Even what may be our best experts may be mistaken. Science, even the best science is itself fallible. I'm not in that sort of business of identifying who the fake experts are. I have something to say about it, though. An expert is anyone paid for their opinion. Okay, so the category of fake expert is sort of out of sync with my framework. But the idea of expert failure is not. Okay, so how do you know, what are the red flags of expert failure? Well, that's why we need competition. It's hard to know. It's hard to understand. Okay? Precisely because you don't have the expertise of, in the area that the expert claims at least to have good knowledge. So that's why we need competition. If Carmelo and I are competing experts, okay, let's say in a courtroom, right? So that, either his team is going to win or my team is going to win, right? So we have completely diametrically opposed interests. Okay? Well, and let's say that you're the judge or you're a juror, maybe it's a jury trial. Which expert are you going to believe? Are you going to believe Carmelo or are you going to believe Koppl? Well, if I stand up and say, well, I'm really smart, I'm a wizard, I know everything. You lay people, you can't understand the incredible knowledge that I have. So just listen to me and do what I say. If I take that posture of a wizard, what can Carmelo do? He could be like, oh, I'm a smarter wizard than Koppl. But if he's wise, and I know him well enough to know that he is wise, he will instead say, well, this is what Koppl was talking about here, and this is what he meant there. But you see, there's this problem, and he'll explain it to you. He'll teach you. Knowing this, I'm going to avoid that posture of a wizard in the first place. Okay? I too will end up as a teacher. Okay? So I like to say that competition turns wizards into teachers. Okay? So then you may still err, the experts may still make mistakes, but you have a much better chance in a world where things are explained, where experts are teachers, of being steered wisely than in a world where experts have an incentive to be, wizardly. So that's question number one. The media's role in drumming up the reliability of experts. Yeah, certainly in my country, in I think Europe and the West in general, and I imagine more generally than that, the so-called mainstream media are very much in the thrall of the experts. The cultural elites in my country, I'll just make it my country, the cultural elites in my country are dead convinced that knowledge is this hierarchical thing, it's embodied in the experts, and it is to be administered by the state. I don't quite understand how we got into this mess. I guess we got into this mess because we have the administrative state, which encroaches ever more, thoroughly onto every corner of life. So they're kind of in the system. And you have to seek out contrary voices. And it's a challenge because you don't want to, because it's hard to judge the different media, the different voices within the news media, I'm trying to say. So I think it's true. I think it's happened. I think there's been this presumption of the superior wisdom and the superior virtue of experts. That's the one that sort of really gets me. I sort of understand, like the philosophical mistake of thinking that like knowledge is hierarchical. The news media, I'm a college professor. We all went to college and we learned our lessons and it's all about what's in the book and everything. And I mean, I love that. I'm a college professor. I chose that to do that all the time. So it was a great effort for me to learn that how actually the relevant knowledge that makes society go is much more practical, much less theoretical, and it's dispersed and distributed and fallible, and it's embodied in the system. So I understand the sort of philosophical mistake of viewing knowledge as this bookish thing in this rigid hierarchy. I think it's a mistake, but I kind of get that. Now I've lost, what was the other point I was making about the media that I was complaining of them?
The media relies on experts?
This sort of buy-in to the administrative state, that's a puzzle to me. I don't quite understand. That was it. The view that the expert is not only has somehow more better knowledge, but is a better person. This belief in the goodness of experts. That's what I'm saying. You just read what people say in some of these writings. I find that puzzling. How hard is it to understand that experts are people? Okay? Why do you believe not only in the epistemic superiority of the expert, but in their moral superiority as well? I'm stumped by that one. I can't tell you that one. My best explanation seems weak, which is that, well, they're elites, they're part of the system, they're in, they're not out. Maybe that's the explanation. I don't know. Best way to dispense advice to others: carefully, humbly, prudently, okay? And as a teacher, not a wizard.
Thank you very much. There are other questions? It seems no for the moment.
Okay, maybe come to the question.
So I think we can close here our session if there are no more questions. The video will be available on YouTube most probably this afternoon here in Malaysia, and we will post the link on our Facebook page. So if you're interested also in following up the updates of the Center for Market Education, like our Facebook page, and you will find there all the materials you need. We tend also to post there articles and that are relevant for the debates within the econ discipline, which is a part of our mission. But also you can access to our website marketedu.org. There you will find my email address and contact me to be in touch for future initiatives. Most probably the next webinar will be on the unintended consequences of the lockdown. Our School of Thought in Economics, the Austrian School of Economics, tends to stress the importance of unintended consequences on policies and how they are usually disregarded in the current debate. So once again, I would like to thank Professor Koppl for having been with us. It was a great honor.
It was a great pleasure to be here. I appreciate so much you having me.
If you have been stimulated by this discussion, you can buy on Amazon, Expert Failure, in paperback, hardback, or Kindle version, Cambridge University Press 2018. Thank you very much, and see you next time.